the room, getting into the meeting.
Okay.
Did you have a problem trying to get in? It's okay. Would you like to share your screen?
No.
Do you have a presentation, a PowerPoint?
No. I'm just going
No.
to speak my experience with you.
Wonderful.
The PowerPoint is going to lose the transaction between you and me. I say the talk between you and me and your team and me, that is the best one. Concentration is a perfect one.
I quite agree.
But if I'm going to all this thing, the concentration is going to be lost.
Say no more. I will invite the others to join us.
And look at those लोग आ गए.
इसमें लाइव चल रहा है. नहीं, उन लोग अभी वही बोले ज्वाइन करते हैं तो फिर हम वो ऐड कर रहे हैं. ज्वाइनिंग हो गया.
Good afternoon, everybody.
Hi. Good afternoon.
Hello, and welcome, and thanks so much for coming. I'm sorry we're a little bit late, but we're here, and we're ready. And Dr. Khan over there in Qatar, we're very, very pleased to have him to join us this month and for the recording of this talk. And I think without further ado, I'm going to ask Dr. Khan to open the meeting. If you'd be very kind, thank you very much.
All right. Thank you. Good evening to all of you. And from you, good afternoon. And can I ask just among you five, which one is the last one with me in my last webinar?
Put your hands up if you attended Dr. Khan's previous webinar, which we had last year. Just the one, isn't it?
Palmer.
But there are others who will be here for the recording.
All right. Now, welcome to the seminar of Dr. Decoding Uptons, who arranged this discussion with me and you, all of you. And today's seminar is very important and on the basis of the practical point of view. Classical, homeopathic, practical point of view. This seminar is, I think, is very helpful to you in your practice life. Are you following my language or my voice? Slight little bit difficulty, little bit. Okay, so now I'm going to start the difficulties, especially in our daily practice life, what I feel, which I like to share with you. And I hope that whenever you got any opportunity in your practice life, you will try my suggestion, and I hope you are not going to fail. That much I assure you. The things which I am going to share with you is all are purely classical according to Organon and Hahnemann and post-Hahnemannian stalwarts. they will going to develop the circumstances which is difficult for them. They suggest us, and I'll try in my level best in my practice, the failure which I have got in my life and how I am going to become uplift once from this problem in my practice. Number one, I am going to discuss with you. During my early life, as you know that in Calcutta, is a very good environment of homeopathy. The college where I learned is Calcutta Homeopathic Medical College. There are good amount of stalwarts are teaching there and showing the cases in the OPD and IPD. I have really very lucky enough that I got some good stalwarts in Calcutta where I got opportunity to sit with them and learning the beauty and art of homeopathic practice. Are you following me or not? Up to difficulty? Up till now? Okay. You know that Organon of Medicine is written by Hahnemann, and we know that with the help of Organon, we are going to get a better result in homeopathic practice. You must need Organon. Today I like to giving some of the examples of uplifting my cases or decoding my cases with the help of Organon, the art of the healing. Some of the stalwarts like H.C. Ellen, whom I enjoy their writings and get very good success by his advices in my practice life. So, in this situation, I will show you one of my case where I got only failure. The case was the headache. I prescribed as per my that knowledge, considering patient as a whole for headache. Result was not as much as satisfactory as I want. A very painful condition to me. Then next prescription failed. I'm not going to full detail because we're killing our time. As you're giving the very good notes. We reached 253 according to Organon, not rubbish thing. We don't want to discuss till the time of not very important, relevant. Since it's two failure, is very shocking to me. Then you know that in Calcutta people, mostly we have prescribing in the classical way. I mean, Hahnemann's and post-Hahnemannian stalwarts, those who believe homeopathic philosophy, and according to Organon, the art of the healing. So in this situation, the condition was the headache is always going to be alternate with cough. With my pressure, I used the cough indication also, but failed. Slightly relief. Fail means slightly relief, not satisfactory. In this situation, is a very troublesome situation in the practice life. Apart from your best effort and your case is not improving as per your desire, you know that, this is my opinion, that this is a case failure means your failure. And case success is your success. So always cautious about your own success. I am too very much aware about my success in my practice life. And my every case where I get success, I feel pleasure. So until and unless you did not get any pleasure in your practice, practice is going to be zero, in my humble opinion. So in this case, one day I am going to study Organon. You know that in Organon, Hahnemann giving two group of the problem. First problem, the cases having alternating symptoms, side alternate. And this alternating will two type. One is with fever, another is without fever. With fever, there should be always fever, like intermittent fever, like malaria or some other diseases. Not fever means any part of the disease part is going to be alternate by other parts of the body. Just like this case is, my headache is constantly alternating with the cough. You know that first thing that very difficult to achieve in the case taking this alternating symptom. Very difficult. That's why my humble request to you that always care your cases in depth with all the sequences should be keep in your mind. So apart from my failure, I am starting to notice that this headache is a constantly features alternating with cough. Now, I've gone through the materia medica and repertory, but not getting satisfactory result with the prescription point of view. Then Hahnemann gives one advice in the Organon, the art of the healing, is if you have got Organon, please study it up from 234. 234. Either you touch already or translation of the dozen. English, लिख दो. In the Organon translation, especially by Dr. Dajan, in Bengal we mostly follow the Dajan translation. But I also prefer O'Reilly. I will give you some of the O'Reilly's beauty. Here you see that you have got orally translation of the organ, and you can see this one. Aphorism 23:4, 234, where Hahnemann discuss, right, very good, where Hahnemann discuss about the nature of the disease, not the personality. And Hahnemann say that if the disease has got a strong obstinacy of alternating nature, as my case of headache with the cough, with my best effort, the result is not satisfactory. And with my 2 failures, I could not get result. Then Hahnemann advised that in intermittent diseases, I am not saying fever, intermittent diseases, 234, aphorism 234, where Hahnemann discuss if the disease has got very obstinate nature, of alternating nature, apart from your best effort, your alternating nature is not going to be improved. That is a crossroad of prescribing. This is mostly a failure point of the prescribing. Hahnemann advice in that cases, you give a dose of China. Here Hahnemann prefer a very specific medicine to break the alternating effects of a patient's disease. As in my case, a cough alternate with headache. So in this case, whatever may be the totality, with my full effort, best effort, I could not reaching a best perfect totality of the symptom for the success in this case. I accept my failure. And with the help of Hahnemann's organ, he advised. And you know, one thing I like to share with you, that Hahnemann advice, you should never ignore. You should never ignore. That is my humble request to you. And this is what I have in my life. I got success. One thing, that you always be careful when you have got failure. You get information from organ and the art of the healing. As I have noticed that this intermittency, the cough alternate, the headache alternate with the cough. This is one factor. Headache is not separate, cough is not separate. They have one thing, or their relation is alternative. When the cough is going to be improved, headache return back. When the headache is going to be improved, cough return back. These 2 factors. One, you have a good case taker, so achieve this alternating nature. One. Number 2, Hahnemann advice in that cases, give a dose of cinchona bark. I'm in China. I mostly use China 200. So whenever you have got any disease which have got alternating nature, non-febrile, no fever, means not like any disease. Sometimes you go through the homeopathic materia medica, there are symptoms alternating with one part of the disease, one part to the another part. I will give one more example, because this is a very finest thing and we have to obtain in our daily practice life. Suppose a patient has got a severe throat complaint, hoarseness, with the pain in the knee joint. Whenever you have got pain in the joint, you have got no complaint in the hoarseness. When your knee joint improves, the pain and complaint of the throat is going to be returned back. This is alternative. What I like to impress you, I am giving you example. So any case, if your intermittency, this alternating nature is not going to be improved by your best effort of totality, never forget a China, a dose of China. Never forget a dose of China. And you know that when you try to case taking, sometimes this is going to be ignored. We are not giving any importance. That is the one fault. Our case taking should be covered by every peculiarity. This is also peculiarity, according to 153. In the last year, in this class, I'll try my level best to discuss importance of 153 of organ and aphorism. You may ask to your organization to give you one repeat of the importance of 100. It's careful study of the cases. And by careful study, you are going to notice this alternating symptom. Here you have got no effort to making new totality. Rather, Hahnemann advised to prescribe a few doses of Cinchona, as I am using 200. You may get in your climate, in your environment, in your country, maybe China 30, China 12, but in Calcutta, I have got very good success with a China 200. This is, I think, it is very clear to you. You have gone through the organ, especially your I am saying in you have got organ of translation dozen. Now see in the last two lines. Sometimes necessary to employ as an intermediate remedy. Here also I will give you one beauty of organ, and that is intermediate remedy. If I have got any opportunity in future, I will discuss about the importance of prescribing on intermediate remedy. So intermediate, a dose of potentized solution of Cinchona bark in order to extinguish completely, note it, completely I am saying, which before the China, I am using totality but not success completely. Completely after China, the situation of intermittency is going to be wonderfully covered by a single dose of China. Why I am why I am saying repeatedly, only because of my friend, I have got failures. So I know the pain and discomfort of the failure. As a physician and the patient himself are going to be dissatisfied with my prescription. So complaint alternating in nature, non-febrile, no question of fever, only disease alternate. Symptom of part alternate. I will give you one rheumatic part of the shoulder is going to be alternate with diarrhea. Whenever diarrhea improves, shoulder pain return. When shoulder pain improves, diarrhea return. This is alternating. Here, your all effort with the totality is going to be fail. Never forget Hahnemann. A dose of cinchona bark, China 200. As per in my experience, maybe you have got different experience. So this is one experience which I, after a long years of practice, long years means since near about 25 years of my practice, very active practice, and with my good failure. Apart from all understanding of the organ, I miss the thread of prescribing, which I found in Aphorism 2, 3, 4. You do one thing that you mark 2, 3, 4, study repeatedly and discuss in your cases and watch, is there any alternating symptom? If intermittent symptom, you note it, try a dose of cinchona bark. Okay? Now I like to giving one more thing from Morganan, and that is very practical. You just give one aphorism 183, doesn't it? 183. No, O'Reilly. See O'Reilly, 183. In the last line, in these cases, what cases? That there are cases where the patients feel very ill, but experiences only scant symptom. Means very scanty symptom, very few symptoms. Less for prescribing point of view. This state can be ascribed to a dulling of the nerves, and which does not allow the patient's pain and ailment to be distinctly perceived. The patient has got, apart from all this, is unable to recover from this pain situation due to the poor condition of the vitality. To be distinctly perceived, this occurs very rarely in the chronic disease, but this is mostly in the acute diseases, very commonly. We have got many to prescribe some of the acute cases. Some among you are practicing both chronic diseases and acute cases. Very common. In our daily life, I used to practice the chronic diseases as well as the acute diseases. Acute, especially pain. Never forget this pain. It's troublesome and both painful to you and painful to your patient. I will give you one example of pain in the kidney region. In the kidney region has got severe pain. Patient unable to tolerate. Your well-indicated remedy is going to be failed. Whatever may be, if you're prescribing, you fail. A very bad situation of every practitioner in the life. I too feel. When I go through the analysis of the case, I found the patient has got very bad situation, very painful conditions, and well-indicated remedy fail. In that situation, the patient's inner feeling, sense, symptom is going to be very poor. Responding capacity of the patient is very poor. That's why I am going to giving reference of the organon, so you can easily understand, read it, and you will get the best possible things by which you are going to practice in your life also. So never forget a dose of opium. Especially in chronic cases, okay. I could not get serious cases, but in your acute cases, pain in the joints, kidney pain, pain in the gallbladder, where the patient's effort is very poor, is not able to control. Never forget, if your indicated remedy is going to be failed, never forget, my friend, a dose of opium. This is also Hahnemann's advice in Approach 183. 183 in O'Reilly. And if you are going to say about dozen, you have got O'Reilly or dozen? O'Reilly. क्या है original? No, by O'Reilly or dozen?
Yeah. Dr. Khan is asking which edition of the Organon people have, whether it's this one is by Wendell Brewster O'Reilly.
Alright.
This is the one.
O'Reilly.
This is a modern translation.
All right.
Or dozen.
So you just go through the O'Reilly 183. Yes, very good. You know, there's always, if you are going to be help with the organon, your practice is not going to be unsuccessful. Your successful practice required the good knowledge of organon. A working knowledge of organon and materia medica for you people, those who are very busy with the life, practice, and their some of their own work, working knowledge of organon. You put O'Reilly. O'Reilly will give you a very good insight for the prescription of Hahnemann. So Hahnemann advised, especially in the cases of the acute diseases, severity of the pain and your indicated remedy is going to be failed. Never forget a dose of opium. Here I use opium in my own practice life 30. One thing I like to share, that whenever you are going to practice opium, use opium, prescribe opium, you see the people, in eyes, people, they are always constricted. Belladonna dilated. Belladonna dilated. Opium constricted. So, best advice for opium prescribing. The patient has got a very pinpoint eyes and pinpoint hole of your eyes, of your patient eyes. So that's why my humble opinion, so whenever you have got any opportunity to prescribing opium, especially in acute cases, according to Organon, Hahnemann, Aphorism 183, never forget opium. So like that, in Organon, the art of the healing, there are good amount of the areas where Hahnemann giving Organon खोल के रखा करो यार.
उधर है सब.
So they are we have got already like that. Window. One more thing I like to वो जो हम लास्ट डोजेज वाला बात 6 एडिशन के फुट नोट पे जो बोलते हैं 282 है. In Organon, I will give you one more thing, and that is very helpful to you. Very practical. Whenever you get any case, this is also my failure. You see this 282 footnote. You see the Organon already translation. Aphorism 282, 6th edition footnote. Footnote in the 6th edition. Hahnemann was since 1790, after the proving of cinchona bark, after the proving of cinchona bark in 1790, he got a new experience about therapeutics, a rational suggestion by a nature. Then Hahnemann always saying about to use a small quantity of medicine, a small dose, not large dose, always condemn large dose. But after 1833, which he is going to get 6th edition of the Organon, as O'Reilly is the 6th edition. He found and he used his experience that miasmatic diseases, very simple miasmatic diseases, those who are on the surface, not suppressed. You know that miasm always has got two phases. One primary phase, most rich phase for the prescribing. And after suppression, we have got secondary stage of the miasm. The best way of prescribing miasm in acute disease is in primary stage. Never use and minute doses, small doses. Never use. This is 282 footnote. Hahnemann said his rich experience of the later stage of his life, when he is going to be in deathbed, he got experience that primary stages of the miasm required large doses of the medicine, not small doses. लिखा है. You see the O'Reilly 282 footnote. I am clear? Okay. Then the large dose, these two things. Hahnemann always condemned large dose, but experience taught him to prescribe in the primary stage of the miasm large doses. And the large doses, especially of LM potency, 50 millisiemens potency. Hahnemann mostly come to the conclusion of the best potency for prescribing, I mean scale of potency, 50 millisiemens potency or LM potency. So in this situation, the O'Reilly will help you to translate the core of heart, of feeling of Hahnemann, using in the bedside, that large doses is only helpful in the primary stage of the miasm. You give a small dose, failure. You give large dose of 50 millisiemens potency, you get success. This is some of the beautiful suggestion of the translation of O'Reilly, the feelings of Hahnemann. You may try your practice. Then I'm just going to touch what is the primary stage of the Organon. Primary stage of the miasm is when the patient has got touch with the miasm or patients. The patient has got, there are two groups of the miasm. One, Sora. Sora required only touch. Touch is enough to transfer soric miasm to the another person. Touch only required touch. And in this case, Hahnemann advised to give the specific dose medicine is sulfur in LM potency. This is 282. You should give sulfur in a case of the sora or sonic manifestation. Now, simple I am touch here. It's going to establish the unique understanding of Hahnemann regarding organon, that he required to prescribe medicine in small doses, but in 6th edition. He is going to accept the importance of large doses also. 282 aphorism footnote. These are some of the suggestions which I like to share with you. Now, I am going to give some of the very painful situation of the cancer. Severe situation of the pain cancer. You heard the name of a beautiful book by Richard Hughes, Pharmacodynamics. Very good. You just read it, my friend. Richard Hughes, which Hahnemann, one of the best stalwarts, but believe in some of the lower potency. See, in Silesia, you have got, anyone have got this book? Richard Hughes, Pharmacodynamics. I have, very good. See, last two line of Silesia. A Manual of Pharmacodynamics by Richard Hughes. Some of the very practical which I found success in my life, I like to share with you. 2x बोल रहा देखो.
1x and 2x saturation.
इसको लगाए नहीं हो वहाँ?
नहीं वाला नहीं.
लगा दो. So whenever you have got cancer cases, a patient's pain is unbearable, and your other medicine is not going to be work properly. Right. See, Silesia last two line. See the chapter Silesia.
Last page, last two line.
Huh?
Last page, last two line. Last page of Silesia, last two line of Silesia.
Okay, उसमें वो
हाँ.
उसमें खोल के रखो.
इसमें दिया हुआ है. I have
कैमोमिला का, sorry, कल्पिलिया का आप खोल के रखो.
I have verified his experience with Silesia as an anodyne to the pain of cancer, giving the 1x and 2x trituration.
This is the beauty of Richard Hughes. Yes, yes. Now, खोलो उसमें.
Chamomile.
कल्पिलिया का.
Calculate.
तो देखो मेरा मार्क लिया है.
नहीं.
These are some of the very important clinical tips from the different books which I like to share. Feel pleasure to share. Now, in my practice life, in Calcutta, mostly we use Allen's keynote. I don't know how much in your country and you people are using Ellen's keynote. Today I will give you some of the beauty of Ellen's keynote. Do you have got Ellen's keynote? Right, very good. Very good. Now you people joined with me. All right. Ellen's A-L-L दिखाओ उसमें से.
Ellen's keynote. SC Ellen's keynote.
H.C. Ellen. Yes, right. H.C. Ellen. Keynotes. Big one. A very small book, but rich in experience. I am using Ellen's keynote, Boger's synaptic keynote. ग्रंसे की नोट. ग्रंसी नहीं है.
ग्रंसी उधर उस रूम में होगा, नीचे में होगा मेरा ग्रंसी. इधर नहीं है ग्रंसी.
नैश निकाल दो.
हाँ, ये भी नैश थेरेपेटिक वाला, ये भी नैश मेरा.
ये तो नैश है.
हाँ, थेरेपेटिक से.
There one beautiful book, very practical one. It is
E.V. Nash.
E.V. Nash. यहाँ लिख दिया करो. लिख दोगे? E.V. Nash. As the writer, I'm just suggest you, my friend, that these few books are very helpful, and you get very good successes in your life. Did you? Now note it. You read whenever you have got free time, and your time is going to be very helpful for you. These books are one of the very important successes in my life. Now I will give you the importance of the totality. Now I'll give the experience of Hahnemann, where no totality required, only experience. Now I will give you the totality. Some of the cases I got experience with me, the beauty and the symptom. Few of my cases where I have got good opportunity to prescribe medicine. a medicine like Sina. You know, small babies, when come to your clinic, they are very obstinate. I am not going to say about the disease, whatever may be the name of the disease. You simply look after. The patient is very irritable, very naughty and noisy, very naughty and very noisy. Okay? The medicine is Sina, C-I-N-A. यहाँ लिख दो Sina. Sina, where you will get the baby is very noisy. Wow, 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 wow. And running all full time in your clinic, disturb the whole decorum of the clinic. Very obstinate. In this situation, whatever may be the name of the disease, you just see the tongue. Somehow I got clue to decode my cases with the tongue. The only tongue will help me to these obstinate cases of where my indicated remedy is going to be failed. Sina, you know that they mostly found in a case of the small babies, never bother for the diseases. Whatever may be the name of the disease, if the baby is tongue clean, is very tongue. Tongue is very clean. With obstinate child and worms infection. Worm infection. Nowadays very common in, I don't know about UK, but in India, small babies has got most of the complaint related to the worms infection. Very common in Calcutta, very common in different parts of the India. Just see the tongue. Put pressure here and put the tongue outside. If it is clean and very noisy baby, very obstinate baby, tongue clean, simply ask for the mother what things your baby likes to enjoy. She shouts you, sweets, sweets and sweets only. Baby demands sweets and sweets only. Tongue is clean, very obstinate baby. Never forget, my friend, a medicine like Sina, whatever may be the name of it. In India, I will tell you, this worm infection is going to produce deep-seated defect in the body of the patient. You only wash tongue clean or not. Now I am giving you some of the clinical tips which I have got in my practice life, daily practice life, and I found good successes. Especially in a case of children. And you note it also. Allen's note you have? Allen's note? Right. You just, very good. You just go through the relationship. Sina relationship. है ना? हमसे भी गलती हुई है, सीना बोल रहा है, रिलेशनशिप.
Frequent to be taught in children.
See the Sina relationship. वो तो second paragraph. Has cured aphonia, means absence of voice, hoarseness, aphonia, from exposure. When aconite phosphorescence spongia failed, how much is powerful Sina? You know that especially in Calcutta, small babies are mostly suffering from whooping cough. In whooping cough cases, I found many times Drosa will help us a lot. They will give a very good result. But after giving result, still patient is suffering from the whooping cough. If you put tongue outside, you will find tongue clean. Never forget Sina. So Sina has got, especially for children, a magic medicine. Only you need to touch, see the tongue should be clean. This is an important indication, a clinical method of teaching homeopathic materia medica in the practice life. This is clinical method. As allopathic has got clinical method by stethoscope, by pulse, by percussion, many things. The homeopathic medicine has got clinical method to just watch the tongue. I am just going today so few of the indications of the tongue which I got give me a marvelous result in obstinate cases. You know, of painful conditions, very painful conditions, that is cramps. In cramps, if you like to have some compression, you have got Nash, EB Nash. Have a Nash, very good. Open the MacFoss. फटाफट खोल दिया करो यार,
नाम से
पीछे से
नहीं-
देखो. I enjoy Nash in my clinical bedside. I got very good success in some of my very obstinate cases, troublesome cases. MacFoss देखो ना. These are the classical books. You have to friendship with them.
Throbbing pain is so characteristic of nausea.
मैकफॉस है ना,
हाँ.
कंपेरिजन है, देखो उलट के पेज, नहीं है. Seeing MacFoss, E.B. Nash, he discussed the many of the clinical tips of the different type of cramps. (321) page है क्या? Yes, thank you. Thank you, Dr. Allen. The page number is right, 321. I have got the same page. I have got same page. There are few medicine which are tested and get success with the Nash and me also. But whenever you are going to prescribe MacFoss, see the tongue. And tongue is clean. Severe cramp, tongue clean. Severe cramp, tongue clean. This tongue symptom is away from the disease, away from the cramps. You will get cramps with the tongue clean, MacFoss, MacFoss, MacFoss. In every day, our daily practice life, mothers, children, young adult people having severe cramp in the calf muscles. Very bad situation. We need few doses of MacFoss in cramp when your patient has got tongue clean. I am giving you short symptom. You note and prescribe MacFoss. MacFoss, cramp, tongue clean. 200 repeated doses. You will get result. So this tongue symptom sometimes very useful for prescribing point of view. और कहते क्या स्वेट का सिम्टम भी निकाल लेना चाहिए. Now, I will see you one of my case in my practice. You know the thigh, posterior part of the thigh, a severe cramp. Not responding even painkillers successfully. He came to me at mostly her age is 70 or 75 like that. I watched all symptoms from head to foot. But I got striking features in the tongue. Tongue is purely clean. My experience taught me that whenever you have got the cramp, pain, whatever may be the places, if the tongue is clean, never forget a medicine like MacFoss. Very common thing which I like to discuss with you, and nausea. whenever you have got constant nausea, it's a very common feature you are going to face in your clinical bedside. Nausea. Mostly in a case of the female and children also. When you touch the mouth and find the tongue clean, never forget ipecac, ipecac, ipecac. Okay, now I like to say about a medicine. Again, I am going to say about the beauty of Helensky note. Now see a medicine, entim crude nikalo. See entim crude. Entim crude, Helensky note. Most of the gastric complaint of entim crude is to be found due to the poor digestions, easily disturbed digestions, and the tongue is going to be coated. H.C. Allen says about this is a red strand of the remedy. Most strongest indication of the entim crude when noted first. Tongue is thick, milky, coated. Once I got opportunity to practice and the UP, Uttar Pradesh, and the city is Lucknow. Your internet connection is unstable, bol raha hai. So I have got opportunity to few days, about a few months like that, to see cases, a very acute cases, long line. Found most of the people has got suffering from disturbed digestion. People, whatever maybe eat, their digestion is going to be disturbed. Very weak digestion. It is very common nowadays because our food is not very genuine, perfect. In that case, if you will get thick, milky, white coated tongue, whatever may be the name of the disease. If you have got headache, thick, milky, white coated tongue, never forget. According to Allen's entim crude. If you have got severe pain in the bronchial spasm, cough, asthma, bronchitis, if there is thick, milky, white coated tongue, never forget entim crude. It is a severe pain in the joints, very severe pain. Your indicated medicine is not working. So-called indicated remedy. Just watch the tongue. And if you will get thick, milky, white coated, never forget entim crude. This is the beauty of Helensky note I am discussing. Now I am going to discussing one personality prescribing. from the Erinsky note. Erinsky note in pulsatilla. Just see this. Ultra. See in the pulsatilla. So in this case, pulsatilla personality. Read it यहाँ रख कर क्या है बोल रहे हो? पढ़ के बताओ.
कौन
First.
हाँ हाँ. Nearly all complain.
हैं?
Nearly all complain.
अरे मना किया है उसके लिए. हम नहीं. Elinsky note said, thirstlessness nearly with the all complaint. So if you have got any case with the gastric problem or the lungs problem, if your patient is thirstless, a very hot climate, no desire, no demand for the water. This is thirstlessness. So a patient who is very kind-hearted, for pulsatilla you remember, pulsatilla personality is very kind-hearted, very soft-hearted, and weeps easily. Patient has got thirstlessness nearly with all complaint. Thirstlessness with the all complaint. In this situation, whatever may be the name of the disease, if the patient disease in the mind, never prescribe on the mind. You must prescribe with tongue. Is patient's tongue of pulsatilla is slightly dirty. But remember, thirstlessness. Thirstlessness is one of the strongest characteristic feature of the pulsatilla. And very kind-hearted person, very weeps easily. Love and enjoy consolation. So enjoy consolation, aggravates consolation, but consolation relieves. Thirstlessness nearly with the all complaint and very kind-hearted personality. This is a symptom which I found as a characteristic personality prescribing. My many cases of bronchial spasm, my many cases of gastric problem, my many cases of the different type of fever when you have got thirstlessness. Kind-hearted personality, thirstlessness, aggravation, consolation. Aggravation, consolation. And the patient prefer no thirst at all. High rise temperature, 104, 103, no thirst. These are some of the practical experience which I found in the different prescriber, and I confirm in my practice life. Whenever you see the kind-hearted personality, always you will find the patient is thirstless. and whatever may be the complaint.
Consolation, desire, amelioration.
When the patient has got love for the company, enjoy company. Seeking consolation means enjoy consolation. Love consolation. Starting from small babies to old age like me, whenever the patient has got kind-hearted personality, thirstlessness, even in the high rise of the temperature, love and enjoy company. Never forget perception. These small clinical confirmations which I share with you only because I got success in my life. Next prescribing which I like to share, that a patient who is suffering from asthma, asthma, severe asthma, homeopathic drugs taken, allopathic medicine is taken, is going to be giving a slightly improvement. No successful treatment. Now the question is going to be discussed with the case taking. I found the patient is very depressed, always in dark mood, depression, and the most of the time, as you know, that in a case of the asthma, complaint mostly aggravated at night. After good amount of the case taking, the drug which I like to prescribe is already given by the other physician. Then one question I ask, to the servant of the gentleman, ever you find your boss is smiling in nature? She replied me, I never saw he is laughing or smiling in my life whenever I watch her. And the patient has got no smiley face. This is what I found in a case of a medicine where the patient has got never a smile in the life. But you should confirm with this symptom the most important personality which I like to say, wife. And mostly the servants. My few cases, not much cases, few cases, I got very good results with the medicine when the patient has got no smiley attitude in the life. So depressed. Depression and depression only. never smiled in his life. That I confirm by the wife and the servant. You know, I prescribe aurum metallicum. Aurum metallicum, a medicine is mostly antisyphilitic. Antisyphilitic medicine, and always find the patient has got so much depression that she and he is never able to smile. A smile means a cheerful face. If you lost the cheerful face of your patient, whatever may be the name of the disease, never forget. My suggestion is aurum metallicum. In aurum metallicum, it is a so depressed mind that I cannot say that aurum metallicum is going to be helpful. Or, yeah, now see the Elensky note in the aurum metallicum. Life is a constant burden or black letter, profound melancholy. Profound melancholy. And feels hateful and quarrelsome, always fighting in mood, desire to commit suicide, enjoy the suicide, no love for the life, and that's why the patient never smiled in the life. And life is a constant burden. All this is given by the Ellen on last line 3, with nearly all complaints. To this mental symptom of many depression or deep depression, with whatever may be the name of that, it is a constitutional prescribing. Never you smile. This is my clinical experience. As in case you would find nearly with all complaint, thirstlessness, pulsatina. See, nearly with all complaints, depression, aurum metallicum. And the thick, milky white coated, whatever may be the name, never forget, antim crude. Very simple, very powerful, very effective medicine by very simple symptom. These are my own experience where I found successes. You know, some of the books are very helpful. Very helpful. And the writer, I'm just give you the to enjoyment or enjoy the book. To some beauty of the different books I like to share with you. It is not possible that all things is some of the cases. That's why I not fully discuss my cases, but only short cases. Come back to some of the other medicine where you have most of the children, small babies cases. Right? Small babies cases having severe complaint in the liver. Mother come to you and troublesome mother say about the baby whenever feed the milk of the mother, they pass stool very quickly, just like a jet. These are the indications of an enlarged liver. Clinical method, enlarged liver. Especially in children, these are very common. Baby feed and pass stool. Feed and pass stool. Very troublesome conditions. Allopathic physician is going to be diagnosed the cases in large liver. Few doses of homeopathic calcarea ars. The calcarea ars in my all troublesome cases give the win. And I got very good result with calcarea ars whenever patient is taking milk and pass stool, forcefully pass stool. This is calcarea ars. Now, you know that some of the cases of in cases of you have Boger synaptic node. Boger synaptic node have third page mind वाला पैदा करो एक right. Those who have Boger, please open see the page in my book page is page 18 or the chapter is time. Have there is one single remedy where the patient has got aggravation from 10 a.m. to 3 p.m. You have it to 10 a.m. to 3 p.m. a.m. to 3 p.m. That's dedicated to tuberculinum. This medicine I found in Boger in repertory chapter where Boger discussed about the time importance. You know that I have got in my life a severe headache. You know that two things I found in my practice. One is headache, another is leukorrhea for women. Very difficult to cure. Very difficult. In these cases, I remember one case of mine, patient who have got severe headache is a school teacher, mathematics teacher. And these are the mostly school times, 10 a.m. to 3 p.m. Good amount of the treatment, medicine, not satisfactory result. These are the cases where I found obstinacy. The cases need decoding. The study of Buga taught me from Tuberculinum, the repertory chapter is time. I have to give Tuberculinum LM1, means 50 medicinal potency. Once daily. Once daily for 16 days. Patient has got marvelous result. I decode the case. And the symptom of the tuberculinum is one of the very rare symptoms, but very helpful symptom, especially in my case. So whatever may be the name of the disease, not only headache, if it is going to be started, aggravated, increasing from 10 a.m. and leave 3 p.m. Never forget tuberculinum. One strongest indication, for my knowledge is concerned, I could not find any other medicine. So whenever you will find any medicine which is not caused by any other symptoms, simple one symptom, one medicine, if it is prescribed, never get, you're bound to get success. So whenever you have the patient who has got aggravation from 10 a.m. to 3 p.m., this is one of the strong indication of the tuberculinum. Why I repeat? Because of that, we could not giving any importance to prescribing tuberculinum, especially this time modality, 10 a.m. to 3 p.m. So few things which I have got success in my life from the different books by which I am going to decode my cases.
ड्रॉसेरा वाला बोलिएगा ड्रॉसेरा हार्ट प्रॉब्लम.
You know that Drosera, a medicine, mostly we know the cases of तुम बोलोगे हमको मत बोलो. All the cases for the prescribing Drosera, Honeyman's one of the successful medicine in the whooping cough. Drosera. Drosera, in my opinion, as per Dr. Margaret Tyler. You have book of Margaret Tyler? Right. Margaret Tyler drug picture. Please read Drosera chapter. She claimed that Margaret Tyler is going to be known Drosera and Honeyman. Nobody knows. Yes. But now I claiming that Margaret Tyler and Hahnemann, along with me, successfully knows about the beauty of prescribing Drosera. Drosera is very helpful in cases of the tubercular diathesis. In your environment, I think the deep-seated tubercular effects is very common. Once upon a time, I had to visit UK, and I saw many cases. Most of them I found there are tubercular diathesis. In remote past, they have got tubercular diathesis. They continue. You know that in that cases, I will show you. You know the sour, S-O-U-R, sour, right? So whenever a patient, apart from all the problem, he hates sour, taste and smell both. If a patient has got strongly aversion for sour both taste and smell. If this keynote, strong characteristic you will find in your case, never forget to prescribe Drosera. Never forget to prescribe Drosera. This is a very, in my opinion, very highly characteristic feature of Drosera. And note it in your practice, and never bother for name of the disease, diagnosis of the disease. Only when you get the patient has got severe aversion for both taste and the smell of sour. Never forget Drosera. Either in cough or in the bone pain. This is what I found in my practice life, the beauty indications, the remarkable indication of the Drosera. कितना नंबर सिम्टम है याद है?
70. Materia medica pura.
See, the materia medica pura, symptom number 70. Have anyone? In materia medica, you know that. निकालो यार. नहीं तो दो यार. दिखाओ. Now I'll show you from the materia medica pura. Materia medica pura of symptom number 70. Study of materia medica pura is always from the number of the symptom. Symptom This is the last one. Symptom number 70, great sensitiveness to the sour smell. This is Materia medica pura. And you know that Materia medica pura never fails. This is Materia medica pura, great sensitiveness to sourness. In my opinion, sour smell, sour taste both. I have got many cases success by this prescribing or this symptom of the honeyman. And that symptom, number of the Materia medica pura is 70. Just note it and later on you will study this one. हटा दो इसको.
रिपोर्ट दिखा दे बोला हार्ट का होल वाला रिपोर्ट.
नहीं बाद में दिखा. ये तुमको बोर्डिंग दिखानी पड़ती है. ना. So my friend, few things like a clinical tips which I got success in my practice life, I like to share with you in the different books and different prescribers. And I hope that the things which I discuss with you is very fruitful. And now about one more thing which I like to discuss from the practical point of view. See the bogar. Bogar have you? Bring the bogar. खोल के दिखा भी देखो.
कौन सा?
वहाँ भी यहाँ नीचे लिखा हुआ है सिम्टम. Bogar give you one clue for understanding of the symptom. Which symptom is very strongly marked for prescribing point of view, which was suggested by Hahnemann, noted by Bonnigerson and Bogar, which I like to share. See the Bogar books. The page 338. Before the chapter of the complementary remedies, he is quoted a symptom of hearing, a suggestion of hearing, Master Constantine hearing. He said that appearing last in the proving have the highest value. Symptoms appearing in the last in the proving has the highest value of prescribing. Now, I give this clue to you people as a hard study, or make your life to study Hahnemann's Materia medica pura. Whenever you study Hahnemann's Materia medica pura, note the last appearing symptom.
पार्ट 2 है, पार्ट 1 नीचे कहीं होगा.
ये मेरा मार्क किया हुआ है.
नहीं, मेरा वाला
है.
मेरा है.
लास्ट अपीयरिंग सिम्टम
मार्क किया हुआ नहीं होगा.
Now see the Materia medica pura. And there is always the things is in given here. You see the mercury, page number 158. There are under bracket. Under bracket there is a name. This means that this symptom is proved by this particular man. Okay? You see page number 158.
Symptom number बता दो. 300.
Have mark कर दो. You know.
Symptom number 290. Materia medica pura mercury. Mercurous.
Materia medica pura. I'm just giving you one suggestion to study Materia medica pura. Though it is very tough, but if you starting reading by this way, you will get a wonderful result. So in bracket you will see here the tongue on the right side of the hyoid bone feels sore and stiff. Now this is Materia medica pura. Do this under bracket 6th day. Means it was prover found this symptom on the 6th day. I am clear? So the most symptom is going to appear in the last of the proving. That symptom is very important for prescribing point. I've been giving reference boning essence. I've been giving reference hearing. I've been giving reference of the boger and myself. That wonderful successes with the Materia medica pura. Materia medica pura under bracket the days of the prover symptom develop. If it is late, very late in the proving, that symptom is very important for prescribing point. I have many cases with this late symptom. I prescribe and get success. So, what is my today motive? That I will give you how to decode the case. Your obstinate cases. How you decode? I am giving reference, books, name, indication of the symptom as well as how to study Materia medica pura. I think if you study accordingly, I assure you, my friend, that you will get beautiful result in your practice. Your practice is going to be uplift. And that's why all this suggestion with the references is helpful. Only if I talk no reference, you are in the blind. you are in the black side of the practice. No. That will help you if you give the reference to you. You have got whole year to study. Or whenever you have got any problem in this study, you call me. You talk to your chief, talk with him, then talk with me. I will, as much as possible, I will suggest you how to study. I think, I hope so, in the future, your practice is going to be modified by these few examples which I am sharing with you. Yes, Dr. Dominic? नहीं है, चला गया. Yes, Dr. Dominic, I suggest you, your friends, your colleagues, some of the book, their beauty of prescribing, their importance, starting from Ellen to the Honeyman Materia Medica Pura. Now you just sit together, search one by one, all is going to be benefited to all of you. That's why I am giving the reference. I give the reference of the Boger, Nash, HCL, and some of myself. I hope of this discussion is it should be fruitful. Thank you. Thank you so much. I am thankful to Dr. Dominic who introduced to all of you, and I have a plan just to how to decode our cases. It's a problem to me also, and hope it is a problem to you also. Giving references, that will help you a lot. Some of the reference which I give from the essay, and that is the beauty. Not my friend Serena, not my wisdom. I still could not develop wisdom. Trying to reaching towards the wisdom. Trying to. And you try to make all the books with you. That will also very helpful. That's why the beauty of all the books, even the Boger, I choose and share with you. And they are strong characteristics. Within just few minutes, shall I ask one thing, that do you have got any question?
When is your next session, Dr. Khan?
Just right here.
पूछ रही when is
Huh?
when your next session is?
Oh, next session is up to the Dominic.
We'll arrange another session before very long if we possibly can. We had one last year, we had one this year, we'll make sure we have another one next year.
I have a quick question, if I may.
Yes, you just note it, I will answer you.
Yeah,
Note it
so-
here.
I know that there are two forms of Alan's keynotes, the original and the ones that have been reorganized to go into mind symptoms and generals and physicals. And I know in Calcutta, they don't like the last copy, the newer form. Why is that?
Tell.
हाँ पूछ रही
Huh?
दो एलेंस की नोट है. एक है जो हम लोग यूज करते हैं ये वाला अपना वाला, एक है जो माइंड और ये सब जो किया है. तो वाई कोलकाता वाला लोग सेकंड वाला को इम्पोर्टेंस नहीं देता, नहीं इसको ये करता.
There is a question of appearing symptom. Those who are very mechanical, they use like that. We giving importance to the as writer use their symptomatology. You see that categorization is very important, but the individualization from a author is also much important. And that's why I prefer. I am one of the very simple Calcutta people. Very simple. There are good lots of people. But I prefer the writer, the author, which prefer to write. We should go through that. That is very helpful.
Thank you.
All right, sir. Thank you so much for listening to me. Not my wisdom, my experience. Thanks a lot. Thanks a lot.
Thanks to everybody. Thank you for Dr. Khan. We're most grateful. It's been a tremendous presentation. Thank you very